So everybody will be familiar now with the most recent advancements in form of the large language models like ChatGPT and others. And that's something that's been going on in the background for a long while. We've seen these models become larger and larger and have more and more rich capabilities. A few years ago, the focus was much more on vision. That's where machine learning had most of its early success. So obviously, privacy, right? And generally, the way we share information to a machine, right, and to something that will end up being trained on your data, right, is a huge challenge, right? How there's a lot of new developments in terms of differential privacy and fields that are emerging to sort of allow us to have our cake and eat it, to both train very powerful models on a lot of data, but also make sure that they're not, you can't reverse engineer what data it was trained on and therefore have potentially malicious attacks and figuring out what data was there, including your own personal records. So that's one, right? And I think making sure that we're going to have a good framework for sharing data securely, right, is going to be crucial, and making sure that we have some guidelines around what can be trained, what a model can be trained on and what it shouldn't, right? And something around also user consent. That's one large challenge. But fundamentally, I think we're going to see a very rapid development of use cases where machine learning can be helpful, but then also, probably won't be easily and rigorously verified, right? You'll get an answer, you'll get a prediction, you'll get some gimmick, right? But you won't really be able to verify whether it's going to be correct, right? And that's sort of verifiability is a very hard problem. So the idea behind EVEN and EVEN's mission, I would say, is really simple, right? We want to be the most comprehensive health cover in India, and we want to be incentivized to keep people healthy, right? So even in the name itself, we kind of saw that there was a bit of an imbalance of incentives between what we as patients and customers see as our main objective, right? To get the best healthcare, the best sort of access to healthcare services. And then on the one side, maybe what are the intrinsic incentives of an insurer that is fundamentally trying to sort of have a good claim ratio, service their users, but fundamentally doesn't look after the healthcare side of things, right? They will not typically employ doctors, right? That will be the prerogative of healthcare providers, right? And on the other side, healthcare providers, obviously, their business model is to treat people, and they make money on that, right? And we wanted to sort of unify those so that we effectively have are in the business of helping people through our doctors, right? But also that we shouldn't just be paid on a fee-for-service model, right? It should be a subscription so that, we somehow cover all our costs, and then we don't make money if you're ill. In fact, we probably make more money if everybody's healthy and doesn't need to use our services, right? And so that was very much in the beginning, can we have something that is systematically different from the way things are working right now? And the journey was that I was finishing my PhD. My two other co-founders, Mati and Mayank, were actually already in India at the time, and they had started to look into the healthcare ecosystem in India. We saw that there were a lot of opportunities, right? And that insurance penetration was low. There was definitely health cover was the need of the hour. And we started thinking together about how we could build a better system. And we were joined very early on by Animesh and Ronak, who had a lot more expertise in the insurance and healthcare, side of things. And from that, we built the initial team, and we started out in Bangalore at the beginning of 2021. And now we're very fortunate to have a very large team of excellent people. So we started out in Bangalore, and we partnered with a few hospitals, right? Some of the best names in the corporate hospital sector, right? And we offered basically access to our doctors, and we partnered with insurers to make sure that our subscriber base was fully covered, right? Again, being the most comprehensive health cover, right? And so you would get access to IPD services through our insurers. You could talk to our doctors. We also have an OPD cover, right, that we offer to our subscribers. And this was initially only available in Bangalore. Now, since about November of last year, we've launched in the rest of India. And we're focused now on expanding our services everywhere, right? Making sure that we have more and more reach, more doctors. And crucially, we've also started really focusing on our corporate clients, right? So the B2B segment. And there we think we really have a differentiated offering because not only do we offer access to very competitive rates in terms of insurance with our insurance partners, but all of our B2C services are in terms of teleconsultations, nutritionists, psychologists, physiotherapists. That is also included, right, at a very affordable package, right? And I would say that even though we want to be, and I think we are already, the most comprehensive health cover, that shouldn't come at a higher cost. And that is something that we've been focused on the very beginning, is affordability.